Thank you very much. And now to something very different. A private cardiac facility is now available for the first time to residents of Soweto. The Gauteng Department of Health has given the Clinix Health Group a license to operate at its facility at its Dr. S.K. Matseke Memorial Hospital in Diepkloof in Soweto. Clinix is a black-owned health company that operates various hospitals across the country. To discuss, we're joined by Dr. Mpho Sebesho, a cardiologist at Clinix Health Group. Thank you for being with us, Doctor. What do you think this means for the people of Soweto?
This is actually a huge deal for the population in Soweto. A lot of patients, as you know, particularly black patients, now recently a lot of them have these metabolic issues with heart attacks, diabetes, hypertension and all of that, which means that most of them are now prone to getting heart attacks. And what used to happen before was that patients with a heart attack who live in Soweto had to be transferred out of Soweto, to go to Milpark and Flora, to get the appropriate medical care for those conditions. Now with this, new venture, it means that the patients can be treated at their doorstep. At their doorstep, they can be treated at Soweto.
So there are public facilities, but this is for people maybe with medical aid or looking for a private facility. So they had to drive right out of Soweto, and we know that time is of the essence, isn't it, if there's a cardiac arrest or something like that? Definitely.
We always say that, in cardiology, we always say that time is muscle. So there's that window, 90 minutes, that you have to open up a vessel that's blocked. So if there's a delay, the muscles are going to die because they're not getting enough blood supply. So the muscles are not being perfused. So you cannot afford to waste any time. So if a patient gets a heart attack, the patient needs to be on the table within 90 minutes and the blood vessel needs to be opened within 90 minutes.
The Clinix brand is about taking healthcare to where people are, to townships, and I understand it was inspired by doctors who saw huge inequalities in the apartheid system. Looking back, does that mean anything different in the way you operate, in terms of costs, in terms of anything else?
In terms of, let's just talk about the quality of care. The quality is still the same. It doesn't matter whether you're operating at Dr. S.K. Matseke or you're operating at a Netcare hospital or a Mediclinic hospital. The quality is still the same. However, for the people that live in areas like Soweto, most of them have, your lower option medical aids, your key care, those kind of medical aids. However, so we've come up with a plan to try and accommodate those patients so that, they can be treated like any other patient who's on a higher option. If they get a heart attack, they'll still get the same service. And we've negotiated, with the companies to sell their catheters and the equipment that we use in cath lab at a cheaper price.
Well, the CEO, Dr. Matseke, says this will be world class. What does that mean?
What he means by that is that we've got a beautiful lab, we've got a hybrid lab, and the hybrid lab, what happens in a hybrid lab is that you're able to work, do the stuff that a cardiologist does, and the cardiothoracic surgeons can also come in and do open heart surgery in case a patient needs, open heart surgery for valves or bypass. And the other thing is that the vascular surgeons can also use the same theater if a patient needs, for blood vessels to be opened up in the legs. The vascular surgeons can use that. So that's what he means by that.
And there's talk of this next generation image-guided therapy platform. It sounds wonderful and fancy. What does it mean for lay people?
What it means is that, we've got the equipment there, that enable us to make a diagnosis. It's like a roadmap. So you put a patient on the table, you inject contrast into the arteries. Contrast is the medium that we use. It's like a dye that we use. So if there's a blockage, it will show up, where the blockage is, and use your wires. So use that roadmap, use all that, that imaging technique to help you guide, your wire, where's the wire supposed to go, to help you place the balloon, to help you place the stent so you can open up the blood vessels.
You earlier touched on something that I'd really like to talk about. Black men and women becoming more and more susceptible to lifestyle issues, to heart issues. Why? What are the lifestyle factors there?
So the problem with these diseases is they're all diseases of lifestyle, unfortunately. Hypertension, diabetes, obesity. I mean, people don't walk long distances that they used to walk when they used to live in rural areas. I mean, in rural areas, remember, people, even to this day, people still walk long distances to go fetch water, to get the wood. People still walk long distances to go to school. But then when they come to the big city, people have cars, people don't go to gym, people watch TV. There's nothing wrong with watching TV, but people are essentially lead a very sedentary lifestyle. People are not active. And even the food that we eat a lot of processed food, unfortunately. People don't plant their own vegetables, unlike, what used to happen back in the day. So unfortunately, back in the day at Bara, when I started my cardiology training, we used to be told that to see a patient with a black patient with a heart attack was a taboo. I mean, that never used to happen in the past. It was a disease for white people back then. But now, I mean, even youngsters, it's not uncommon to see a 30-year-old who comes in with a massive heart attack, and it's all related, to this disease of lifestyle.
And so frustrating. So I looked at what the Heart and Stroke Foundation is saying. 80% of heart illnesses, disease, strokes can be prevented. Maybe let's end with just a heart message for the people of Soweto trying to avoid coming into your facility.
So we really have to look at changing our lifestyle. It's the basic things, like, with the sugar tax and stuff, the government is like, going all out, to try and encourage, all these companies
to cut down. So fast food.
So it's fast food, it's sugar, it's smoking, it's lack of exercise, it's stuff like that.
All right. Well, this is very exciting, but let's hope that message gets out there. But wonderful things being done by the Clinix Health Group in Soweto. That was Dr. Mpho Sebesho, cardiologist at the Clinix Health Group.